Let's be honest, we're facing a global mental health crisis. The demand for help is just skyrocketing, but there aren't nearly enough professionals to keep up. So we're tackling a massive question today. Could artificial intelligence actually be the solution we've been looking for? Let's dive in. To really get a sense of how big this crisis is, it all starts with this number, 1.8 million. According to the World Health Organization, that is the global shortfall of mental health providers. I mean, that is just a staggering gap between the number of people who desperately need help and the professionals who are actually available to give it. And here's where things get even trickier. It's not just about having enough providers. It's about what people are actually asking for. A huge meta-analysis found that a whopping 75% of people would rather have psychological treatment, talk therapy, over medication. So the very thing most people want is the very thing that's hardest to get. This isn't just a gap anymore, it's a full-blown access crisis. So let's take a closer look at what we're calling the global mental health gap. The wild thing is, this problem isn't new. The system was already stretched to its breaking point. But then the COVID-19 pandemic hit, and it was like throwing gasoline on a fire. It just supercharged the demand for support, sending rates of anxiety and depression through the absolute roof. And this is exactly where technology steps into the picture. I mean, if we just don't have enough human professionals, is it possible that AI could step in to help bridge this massive divide? Let's explore what that might even look like. Okay, so think about a therapist's day. So much of it is buried under administrative work. We're talking scheduling appointments, tracking patient progress, endless data entry. Now just imagine AI coming in and automating all of that. The shift could be revolutionary. The tech handles the busy work, freeing up therapists to do the one thing that truly matters, connecting with and caring for their clients. And AI can wear a lot of different hats here. It could be a low-cost chatbot for someone who can't get to a therapist, or maybe offer a bit of support between sessions. And for the therapists themselves, AI could be an administrative assistant, or even a kind of co-pilot, helping them with things like diagnosis and treatment planning. So when you boil it all down, the promise of AI in mental health really comes down to these three things: making the whole system more efficient, making care way more accessible for a lot more people, and hopefully making it more affordable. It's a really powerful and honestly a very compelling vision for the future. But, and this is a huge but, this is where our story takes a sharp turn. We've talked about what technology can do, but what about the things it can't? With all its incredible power, we have to stop and ask the really important question: can an algorithm actually show empathy? And that brings us right to the heart of it, the essential human parts of the healing process that, well, technology just can't replace. You see, at the core of any effective therapy is something called the therapeutic relationship. It's not about software or techniques, it's about a real human connection built on trust, emotional depth, and empathy. An AI, running on code and data, it just doesn't have the lived experience, the messy, complicated, beautiful human stuff to build that kind of safe space. This quote, I think, just says it all. It comes from a study about families supporting loved ones with serious mental illness. It's not some complex clinical intervention. It's just getting coffee. It's a reminder that so much of healing is found in these simple, tangible moments of human connection, something an algorithm will never truly understand. But we can't stop the conversation there. Because even if we had the perfect therapist, human or AI, for every single person on the planet, we still wouldn't solve the mental health crisis. We have to zoom out, look beyond the individual, and ask a tougher question. What's causing all this distress in the first place? And this gets us to this crucial idea of the social determinants of health. Now, it sounds technical, but it's a pretty simple idea. The conditions we live in: poverty, isolation, discrimination, not having a safe place to live. These aren't just background noise. They are powerful, direct drivers of mental health outcomes. And an AI chatbot can't fix housing insecurity or systemic racism. And this isn't just a theory. The impact is devastatingly real. Kids who grow up in poverty are 2 to 3 times more likely to develop mental health problems. That's a direct line between our environment and our well-being. If all we ever do is treat the symptom without ever addressing the root cause, we're fighting a losing battle. So where does all this leave us? We've got a provider shortage, we've got this powerful new AI tool, but we also have this irreplaceable need for human connection and these deep systemic problems. How do we put all these pieces together? What's the blueprint for the future? Well, the path forward really seems to have 3 main steps. First, we use AI to augment our human therapists, not replace them. Let the technology handle the logistics so humans can handle the connection. Second, we have to go upstream and start tackling the root causes, things like poverty and isolation. And third, we have to put social justice right at the center of our mental health policies, making sure our solutions are fair and equitable for every single person. So, in the end, this isn't a choice between humans or AI. It's not a competition. The most powerful path forward is a partnership, one that combines the best of technological innovation with a deep, renewed commitment to human empathy and a real, courageous effort to build a healthier and more just society for everyone. And that leaves us with one last big question to think about. What if the future of mental health isn't just found in a clinic or on an app, but in the strength, the equity, and the connection we build within our communities? Something to think about. Thanks for exploring this with me today.